Hi, Dr. Boo with Simply Health here in Federal Way. Had my follow-ups with patients for knee and back pain. One of my gentlemen, they both have severe knee osteoarthritis, and one of them he's delaying knee replacement. He's had multiple things, 7 rounds of PRP, actually a couple rounds of stem cell, and wasn't getting any long-term relief with it. Anyways, I've been working with him. First set of injections, he wasn't quite sure, and actually his symptoms were also coming from his back. But anyways, he had the first session. He said it felt different. He couldn't tell, but I encouraged him, hey, with severe cases, a closer interval follow-up treatment, similar acupuncture builds on it, and your results come back fast, come faster. So anyways, he followed with me 4 days later, and at that point I did injections on him, and he had several days of relief, and I think it was on a Wednesday when I saw him. And anyways, he followed up today, and he said he had several days of good relief, and then last night it started coming back while he was getting ready for sleep. Anyways, worked on him, and he has severe knee bowing, so genu verum. But as I'm working on him, he mentioned something, and I knew his adductors, the muscles of your inner thigh that pulls your leg in, was problematic, and I was focusing on it. But anyways, with osteoarthritis, the middle of your knee, the medial knee, is usually the problematic side initially, and then it becomes everything. But watching him and thinking about it, but he said something that triggered a thought, and I was already working on his adductors, but it made me rethink of where the nerve was traveling and what muscles and everything was affected. So I changed up my injection, or I added a different type of injection, targeting it even better. And right off the bat, he's like, it feels different. Got him up to walk, and he sat up, and then visibly, you could watch his knee was starting to, the middle was relaxing so that his bowed knee wasn't as bad. So I worked on both. He got up, walked around. He's like, it feels really good. So exciting, So medicine is one of those that you have to constantly, listen to your patient as they're describing what their symptoms are, and then constantly learning and adjusting. There's just a lot to the human body that we honestly don't know, and to be humble about it, and to continue learning and adjusting, and helping the patients get better results versus, here's a steroid injection. Hopefully it gets better, or try, but again, medicine is just so fun. I jokingly tell my friends is like, uh, that, every day I'm hustling, but then to me in medicine is like every day I'm learning, right? And if you're not learning, then probably you want to stop practicing, because not staying humble, and you could end up hurting someone. And that's a lesson I learned from a doctor when I was in the Navy back in the 90s. That the day that you stop learning, you probably want to stop, because you're a danger to people. Anyways, it was just fun to learn something different today, and I just wanted to share that with you guys. But yeah, Dr. Booyah.